Civic Association. We have Barbara Bernardino, who's the president. We have Mark Tannenbaum, who is a board member specializing in marketing. We have Dr. Martin Gruber, retired professor of clinical orthopedics and pediatrics at Stony Brook and retired pediatric orthopedic surgeon. And we have Ed Glister, board member specializing in project management.
Yes.
Welcome, everybody. Thanks for being here.
Our pleasure.
Thanks for having us today.
So, just to make sure everybody knows, the civic associations in Long Beach, where we have a bunch of them here, grew, and it's my understanding that they grew out of Hurricane Sandy and the needs of the various neighborhoods to get back on their feet. Would you say that's fair?
Yeah, I would say that fair. Beach to Bay Civic Association was started specifically for that reason, to make sure that the Barrier Island was going to receive that which it needed, to kind of follow the FEMA money, to find out what residents needed from Point Lookout all the ways to East Atlantic Beach. And so our membership, or our civic association, represents the Barrier Island, including Island Park. And that's how we were born. Beach to Bay is a 501c, non-for-profit. All of our board members and participants are volunteers and extraordinary residents on this Barrier Island. Really extraordinary people who have researched and have done due diligence in so many different areas to give us the accurate information we need in any advocacy that we are advocating for.
Okay, so I do want to ask, there are neighborhood civic associations,
Correct.
and there's Beach to Bay. What, if any, is the relationship between them?
Our relationship with the other civic associations have been good. Each organization, as we were doing our advocacy, invited us in frequently to update them on the research that we've been doing and how the advocacy is going. And all of the civic association have assigned a representative from that organization to work with us on the hospital. So not only do we work with the civic organizations, but with many of our community-based organizations, Project Challenge, Circle O, Latino Civic, the MLK. We also have been working with our religious institutions, Father Beckman and Ignatius. We're working with Sister Diane at St. Mary's. We've been working, I can't remember his name, at the Miraculous Church in Point Lookout. We work with people in the school district, the PTA, and others. We've been working with people who have large sports programs. So we have been trying to inform the community the best that we can.
And you're really integrated in many different parts and aspects of the community.
That's correct.
Okay. Now, you mentioned the hospital. Let's talk about, there had been a drive to replace Long Beach Hospital, which was destroyed, I guess would be the way to say it, by Superstorm Sandy. And then a 24-hour or an emergency care, 24-hour emergency care unit was built there with money that I understand was, I guess, gotten by and for South Nassau, and some was used for this. Explain all this.
Well, from what we know through news clippings and other sources, some are reliable, some may not be, is that we were told in 2012 that the hospital was going to be rebuilt. The emergency part of the hospital was going to be rebuilt by 2013, June of 2013. So we kind of were working on organizational things, waiting to see what actually was going to transpire. Long Beach Medical Center still had its license at that point. The emergency room was not allowed, they put the money in, I believe it was $23 million. I believe it was FEMA money, or it could have been insurance money, I don't know that. Mm-hmm. And then the Department of Health would not allow it to open. They didn't close it, they didn't allow it to open, which I think is important to remember. From that, Long Beach Medical Center went into bankruptcy. And with the bankruptcy, South Nassau bid and won the bid for all the things that were under the umbrella of the Long Beach Medical Center, not the Commonwealth Center. That was a private entity. With that, in order to get the FEMA money, now South Nassau owns that property. Senator Schumer and Senator Gillibrand said that the FEMA money that the Long Beach Medical Center originally applied for, since there is no more Long Beach Medical Center, that money now may be used by South Nassau to rebuild the medical services needed in Long Beach. That was in January of 2015, Doc, if I'm not mistaken.
And that sounds like that's a critical phrase. What are the medical services needed by Long Beach? Who decides that? I guess the people of Long Beach, or maybe not. And what's the road to getting them?
So that pretty much was what we were left with in 2015. The community was allowed to have a hearing on what actually transpired with our hospital, how those decisions were made. But because they did not close the Long Beach Medical Center, they simply wouldn't allow it to open. According to the letter of the law, we were not allowed a hearing. And so we were allowed to have a forum. And at the forum, South Nassau was there. I think it's important to know that at that first forum that was organized, that Fran Adelson, the councilwoman, approached the microphone and said that she felt that the FEMA money needed to be spent on this barrier island to provide the services that are most needed by the community, the residents on the barrier island. So that statement was made back then. In February, at the other forum, where South Nassau was present, Councilwoman Goggin got up to make that same argument. And Councilwoman Moore got up not only to make the argument, but to reflect the impact that the lack of the medical services on this island is having on the residents on the barrier island. And so this is where we are today. The hospital has done a report called the Vladeck Report that people seem to look as.
What hospital has done this report?
That hospital was commissioned by South Nassau.
Okay.
We met with Dr. Vladeck, and our medical director will speak to that. The ex-president of the chamber, Mark Tannenbaum, will speak to the economic impact that it's had on Long Beach specifically and on the barrier island and Island Park. And Mr. Glister will also speak to other issues. So that's enough of my talking. Let's hear the guys.
Okay, so let's talk about the Vladeck report, which was commissioned by South Nassau Hospital.
That's correct.
Dr. Gruber, would you like to tell us about that?
Yeah, well, you have to understand, first of all, that the healthcare delivery system on this barrier island was pretty much destroyed by Sandy. Not only the immediate devastation of the storm, but the follow-up meant that physicians left the island either because their practices, their offices physically were damaged, or because of the fact that there was no more hospital here, and without hospital affiliation, it became much more difficult to practice. The end result is we lost about 50% so far of our primary care physician practices, and about the same amount or more of our specialty physician practices. Furthermore, the physicians that are left, the other 50%, are generally near retirement. We don't have young people replacing them, so we can expect to see our general healthcare services further deteriorate.
So now, I just want to say, attracting younger medical professionals to a place that no longer has a hospital and that is separated by water, logistically separate, is challenging.
It is indeed challenging. Now, the key element here is the community itself. Long Beach Barrier Island is home to a unique community. First of all, the island itself is geographically isolated. We got only 3 bridges
Right.
to connect the island with the mainland. All 3 bridges have drawbridges attached, which sometimes fails. So that increases our isolation.
Right, and they bottleneck. They do bottleneck. So
And
when they're open,
summertime traffic, as everybody who lives here knows, can be horrendous.
Right.
So that transportation back and forth from a hospital, although you can say it takes about 8 minutes to go the 15 miles or so to South Nassau, that's fine at 2 o'clock on a Sunday morning in February. It doesn't necessarily apply on a July 4th or a Labor Day weekend
right, at noon.
at noon. So,
any
or any
summer
time for
weekend.
that matter. So this now becomes a problem. Furthermore, public transportation on the Barrier Island itself is pretty good. Public transportation from the Barrier Island to the mainland is not only bad on a time scale, but it's expensive. In addition to our island being unique geographically, we're unique demographically. We have a much higher level of elderly people, defining the elderly as people over 65, than anywhere else in Nassau County, proportional to our general
Really?
population.
Wow.
Yeah. Furthermore, about 4% of our population, over 1,000 people, are in nursing homes. There are 1,035 nursing home beds licensed by the State Department of Health. That's much higher than anywhere else. So these are groups of people that uniquely need hospital care. Not only emergency care, but it means a high incidence of chronic disease.
All sorts of care.
All kinds of care.
Yeah.
Lung disease, heart disease. The elderly, unfortunately, have a potential for falling
Right.
all the time.
And it's a continuum of care where there are all kinds of things that interrelate to each other. And if you're in a hospital, you can have this doctor come in, and then a different doctor with a different specialty comes in and is seeing someone who, you know, the same condition or ramifications of that condition can bring in other doctors.
And this leads to a problem with chronic disease, which needs hospitalization intermittently. You go to the hospital, you improve, and then you go home, and then maybe you go back to the hospital if you have things like diabetes, like pulmonary disease, like chronic congestive heart failure, for instance. All of these things are needed on the island. The other point to consider is the population density. The population density of this island is much higher than the rest of Nassau County. So people are compressed together in smaller spaces. There's a high incidence of chronic disease. 32% of our population are on Medicaid, which means that there's a real financial problem. And this feeds back into the transportation problem. If you don't have the money and you don't have a car, and a cab ride to the hospital is $50, that's pretty much isolates you.
And by the way, sorry to interrupt, but if the new projects that they're talking about on the super block or where HALB has been go forward, this problem of congestion and density will get worse.
And not only
Exponentially worse.
Not only that, if we're going to be putting up this project on the super block, there are going to be people doing it. We're going to have a large force of construction people working in a high-risk industry. So that, furthermore, you're going to need more care. Now, FEMA was promised to use the money, that is, Senators Schumer and Gillibrand, in January of 2015, said that the FEMA money was to rebuild the healthcare delivery services for this island. And what has happened is that the lion's share of that money is not going to this island. It's going to Oceanside and can't fulfill the healthcare needs of the island because the island's population is unique. It's different than the rest of the South Nassau catchment area. Furthermore, the South Nassau catchment area has, they say, around 900,000 people. This island has about 40,000 people. If the FEMA money was intended to go to this barrier island, what we're getting is about a nickel on the dollar. That seems to be wrong, and it seems to be a violation of the promises made to us by our elected representatives. That's one of the reasons we're here. So, what do we need for this island? What kind of health care delivery services do we really need? Well, this is the 21st century. This is no longer the 20th century when Long Beach Hospital was originally founded. Now medicine has changed and it's information-based. We need a hospital that can take care of the intermittent injuries and illnesses that our population is subject to and that are different than the rest of the county. For instance, broken hips in the elderly, chronic heart disease, chronic lung disease, diabetes, things like that do require hospitalization and do require hospital care. We certainly need emergency services, and a freestanding emergency room is crippled by the lack of an attached hospital. Can't possibly have the kind of sophisticated services that a real emergency room needs, because an emergency department uses those sophisticated services rarely. It has to share them with the hospital, or the capital cost of the sophisticated services become impossible to bear.
And it doesn't live up to what was promised originally, by a long shot. I do want to just ask that, what do you say to people, including some in my own family, who had experiences that concerned them with the old Long Beach Hospital and want to make sure that whatever we do get here, that it's a good hospital where the quality of care is, what we deserve to get. Whereas some of us, you can have a bad experience at any hospital, but some people have opinions about the Long Beach Hospital
that's basically an indictment of the management of the previous Long Beach Hospital, and that certainly is not what we're advocating. We certainly don't want to bring that management back. We need new management. We need a hospital that's designed for a sophisticated era. Certainly you can't expect a hospital on a barrier island to be able to deal with highly sophisticated medical problems like major burns, like open heart surgery, like organ transplants. Obviously, that's not going to be done. But the day-to-day kinds of things that can be done and done well should be on this island.